Good afternoon, everyone, and welcome to Conversations with Caregivers, a place for caregivers to get information and share their concerns. Hosted by the Nevada Caregivers Coalition, which is a statewide group of organizations, agencies, businesses, and individuals dedicated to supporting and recognizing the efforts of caregivers throughout Nevada. Today's topic, independent living options for seniors, is the second event in a series highlighting services that are available to keep our loved ones at home, as well as options for residential care in our community. Our first event, Independent Living Services Across the Lifespan, provided a brief overview of services. And today, and in our next session, which is upcoming in October 13th, we'll take a greater in-depth look at services for children and youth. Hello, everybody. We're so glad that you've joined us today. I am your host, Mary Liverati, a longtime member of the Coalition. We thank you for joining us today and hope you'll get a lot out of this and hope you'll be participating with us so that this is a real conversation. We'd like to start today by thanking our sponsor, AARP. AARP is also a member of our coalition. So we would invite you to be sure to check all their information and events that they have listed on their website. And their website is aarp.org/Nevada. Every November, in celebration of National Family Caregiving Month, we host a recognition event to honor Nevada's caregivers. We hope you will join us at this year's event. We are planning an in-person luncheon on Thursday, November 10th from 11:30 to 1:30 at two locations. One is in Reno at the Atlantis Hotel and Casino, and the second is in Las Vegas at Dignity Health. Registration will be opening up soon. If you aren't familiar with our event, you can see highlights from last year on the website, NevadaCaregiversCoalition.com. You'll see it on your screen. And you can also register for the event through this website. We also welcome you to attend our monthly meetings on the second Wednesday of each month from 11:30 to 12:30. We hold these meetings on Zoom. You can also stay connected to us by liking our Facebook page. And we invite you to find out more information about upcoming events by joining our mailing list. You can either join our mailing list by signing up through our website, NevadaCaregiversCoalition.com, or you can share your contact information today in the chat feature, and we will add you to our mailing list. Before we start, just a few quick reminders. Please mute your microphone unless you're speaking. We will have opportunity to ask questions throughout our time today. Just feel free to use the chat for questions and comments. To save the chat, click on the three gray dots in the top right corner of the chat box, and then click on Save Chat. And I have used this and it really works. If you have any trouble with your internet connection, we advise you to leave the meeting and then sign back in. That will work many times. But if you have any other tech questions and issues and you need some help, send a private chat to Marcia O'Malley, our fantastic meeting manager and tech czar. Well, now we're going to get down to what we're here for today. And I'm very pleased to introduce a person that I have known and worked with for, I think, 3 decades. I mean, it's a lot of years, Wendy. Wendy Simons describes herself as born and raised in the old folks' home by a family who pioneered the first housing for dependent and elderly care in the state of Nevada. She's armed with 50 years of knowledge in public-private sector experience, and she is a national and regional expert on assisted living and government relationship issues. Wendy was an owner, operator, and administrator of assisted living facilities for more than 30 years. I just feel we're so lucky to have her here with us today, and she's going to lead a fantastic panel. I know you're excited to hear the other speakers. Oh, did I tell you that I might not have? Wendy served as the Deputy Director of Wellness for the Nevada Department of Veteran Services. She was the Director of Assisted Living Development at the Nevada Healthcare Association, and she was the Bureau Chief of Healthcare Quality and Compliance for the state of Nevada. She has recently been appointed to serve on the Nevada Commission on Aging. And I could go on for the next half hour, but our time is limited. So we just thank you, Wendy, for all your service. And we welcome you and thank you again for moderating our event today.
Mary, thank you so much, and welcome one and all. We have quite a nice attendance today. And as I was looking at who signed in, speaking of AARP, we've got our wonderful Barry Gold, who has been and has been the foundation of all the great work that AARP has done in Nevada. Good to see him on. Speaking of Department of Veterans, I see Rachel Jelenik. She was at the department shortly before I retired. So it's so nice. And our wonderful Barbara, who also sends out all the news from the Marketers Exchange Group and other programs. I mean, I could name you all. So this is just like sitting with a great big family. Mary, you talked about 30 years plus. Yeah, I see a lot of folks that I've known for almost 50 years sitting here in our audience today. So I'm very excited to be your moderator and very grateful to spend time with all of you, including my good friend Deanna Hearn that we spent time with yesterday, even talking about this program. So thank you so much. We have a panel of specialists who are going to help us here today better understand what supported living options are available to seniors in the home and in the community. So you heard Mary say early on, we hope this is interactive. This is not going to be each panelist giving a presentation about a program. It's actually going to be each panelist giving a brief introduction about who they are, what their expertise is, why caregiving touches their heart. And as you hear them, please put something into the chat if you have a question specific to their topical area. But we want this to be really interactive, not just talking heads talking to you. So we're expecting a lot of you to be raising your hands or popping comments into chat. On that note, the experts that we have, and I believe that Marcia's putting up, yes, okay. The experts that we have with us today are equally stellar in their longevity in different components of our wonderful community we call Nevada. The first one is going to be former Deputy Director in Nevada Department of Health and Human Services and the Aging Division, Jane Gruner. We also have retired law enforcement professional and caregiver to her aging in-laws who has some amazing stories about this, Heidi Howe, and program manager for the Cleveland Clinic, Blue Ruvo Center in Las Vegas at the Brain Health, and that's Verla Niebuhr. So if you look at these three ladies that we have the opportunity to have present today, put your thinking cap on and be prepared to send them questions that might be helpful to you. So let's go ahead and start with each of you briefly describing your experience with supported living for seniors. And those of you watching, post those questions as you hear them. Jane, would you like to start the conversation for us?
Sure. Thanks, Wendy. I feel like I'm amongst all my old friends. So I'm Jane Gruner. I'm a licensed marriage and family therapist and retired from state work. I played many roles in the state, from being a mental health counselor to ending as the administrator for Aging and Disability Services Division. Currently, I am using my knowledge and skills to build programs to support individuals with or at risk of dementia and their care partners to live safely in the community, as well as volunteering a little bit to amongst some local nonprofits that support seniors. So first, I just want to say thank you for having me. I don't have all the answers, but any answers I have, I'm more than happy to share and to problem solve with anyone here that needs some additional help after this conversation. My personal journey with caregiving started early with helping my parents when we had aging relatives that needed additional support as they grew older. And in high school, I was a volunteer in a program that paired individuals with disabilities with their peers to enjoy recreational activities. So it was kind of a tradition in my family, and I have brought that to my own family, the same tradition of supporting people when they needed it in the way that they needed it. My journey has included participating with my siblings in caring for my father after an extremely serious surgery, along with my other siblings and my sister's family, supporting her when she was terminally ill with cancer, to provide her number one wish, which was to stay at home. And she was able to do that throughout the whole process. I also helped a close friend and neighbor who wanted to remain at home with her family and her young children. My father-in-law experienced the Alzheimer's journey, and as he became more in need, he joined my family up here in Reno, and he lived with us until he went. He did spend a week in a nursing home, but other than that, he was with us. And then I currently have a mother who's 93 and lives in Wisconsin, and my mother-in-law who's 96 and lives in Reno. And my husband and I are active care providers for both of them. My mother virtually, of course, but my mother-in-law, we are her caregiver along with some paid staff. So the experience that gave me the most significant impact, though, on caregiving is when I needed a caregiver myself. And I have to say that really impacted my view on caregiving. So hopefully we can get more into that too. And my experience was throughout my work in health and human services, I was part of developing different programs and creating licensing and quality assurance programs for the state for residential care. So that's pretty much, and if I have a lesson learned, I think it would be that every situation is unique, and each person receiving care and each person giving care brings their own ideas, needs, values, perceptions, and desires to the experience. And if you look at it that way, it makes it that every caregiving experience is different from another, but there are certain similarities. And probably the major one is that we all have the opportunity to create strategies together, the care partners, to create the best living environment that we can for our loved ones and ourselves.
Jane, that's amazing. I'm sure everybody listening so far, has seen it. I mean, I heard you talk about you doing it as a child, basically, school projects all the way through your lifespan and into the current responsibilities that you're having. Wonderful things that you shared with us. And I hope that triggers some questions with those that are watching today, and moves on, because you're right. It doesn't come with a manual. It's individualistic. Every experience is individualistic. So Heidi, can you share with us your story and your journey, and tell us a little bit about you?
Hi, everybody. My name is Heidi Howe, and honestly, probably like a lot of you, I didn't think I was going to be in this role. I don't know what the heck I was thinking in that, but I didn't, it wasn't something I planned for, and I'm sure many of you have not either. My background, I'm retired after 30 years of law enforcement here in Washoe County. Went through the ranks from deputy to sergeant, lieutenant, captain, and then I was really nutty and I ran for office. Came in first runner up. That's okay, because I had other things to do, like take care of my in-laws. So that kept me pretty busy. I've kind of been in a caregiver role, whether it happens to be law enforcement or other things, I guess my whole life. I do have a stepbrother that when I was 7 years old ended up having cognitive disabilities. So I ended up kind of having experience dealing with him growing up, and I had a lot of responsibility on that. And then fast forward through my career, which kind of continued that. And then my in-laws, my mother-in-law is 87. My father-in-law was 93 when he recently passed away. And we kept him at home living next door until about 8 months ago. And then we got to a point where we just didn't have the bandwidth to do everything. And what I would say is the things I've learned along the way, first of all, you never know when talking to people when somebody's going to have a wonderful idea. Don't be afraid to talk to people and share your experiences with them without overwhelming, but still sharing experiences because they may have an outside the box way of dealing with something.
You just basically mentioned, you know, that your deep dive into caregiving came a little bit later, but you also teased us with the fact that your law enforcement career, if there's any career that really puts you on the front line of trying to read difficult, emotional, personal decisions and how to respond and react in support of good, bad, and indifferent decisions, is something that we don't often have at the table with us. So I really appreciate that in your background, in addition to how you brought it in to your caring for your elder relatives. So I'm hoping again that triggers some of the questions in our group as well. And thanks so much for sharing that story. And yeah, I mean, it's just, it's something we don't often have at our caregiving table, but life is caregiving in various fashions. So that's absolutely amazing. And last but not least, you know, we have our program manager from Cleveland, Ruvo Brain Health Clinic down in Las Vegas. Verla, tell us about you, your role, what your personal experiences are, and what you could throw into the conversation today.
So my goodness, I am very honored that you have even invited me. So thank you so very much. My name is Verla Niebuhr, and I am the Education Program Manager here at Cleveland Clinic. And right now you see me sitting in our library, which is a plethora of really great information. It's mostly related to the diseases we treat at Cleveland Clinic. One of them being Alzheimer's and all the other dementias. So we've got great resources for caregivers of those diseases, but also for our Parkinson's group, Huntington's disease, and multiple sclerosis. So we have firsthand accounts on the shelf, and then people living it. And so I always say, don't reinvent the wheel. Look at what has gone before you, and learn from the masters, right? So my degree is in gerontology and aging studies. And then I am also certified dementia practitioner. Then I received a few little trainings so that I could present various programs. One I work with Tori Diego on right now is Powerful Tools for Caregivers. And that is just a wonderful 6-week little program, workshop program. We meet online once a week for 2 hours. And I've had various people say to me, Verla, I was at the point of suicide until this class. And this class helped me see that there are ways to manage. And so that is a wonderful, Powerful Tools for Caregivers, wonderful class. Healthier Living is another one of those little 6-week workshops. And I recently was certified for dealing with dementia. And so I'm excited to be able to present that for our first time in an in-person setting coming up in August. As part of my role, I facilitate various support programs, and we call them reimagined respite programs, right? So since pandemic happened, everything that we do here switched to an online platform. Everything that we're able to switch to an online platform within reason, right? So because we had one really great program called Memory Cafe that just does not switch well to the online platform, because persons with dementia get very confused by a box talking at them, right? So, but all the other programs we have been able to do, in them, we've met a lot of isolated seniors that have been able to participate It's been social, it's been learning new things, and those are those really important 6 pillars of brain health, right? Of course, it's always diet and exercise and good, healthy sleep, but being social is critical for brain health. And also, so I always tell people I'm paid to play, because I really get to do the things that I love the most. We have 3 different art programs that I facilitate. One is an art museum visit program. One is a conversations program, which is designed for persons living with dementia, that just because there are no right or wrong answers when you're critiquing art, right? You can think what you want to think, and it's right, and it's right. There's no wrong. And then you can relate your own life experiences as they pertain to the art piece, and that there's no right or wrong in that either, because however you remember it is how you remember it. And so that's been a wonderful program for our people living with dementia. And then the last one is Mind and Design, and Mind and Design is an actual art making program. So we ship supplies once a month to everybody's home, and we get together on Zoom and create art together. We have found that to be a beautiful respite for many of our caregivers, because it changes the routine of their day. It's kind of like hitting a little bit of an escape hatch button. Some of them do them with their person that they're caring for, and some of them just take it as me time and do it as me time. So I think Wendy, you had said, life brings us all the role of caregiving, right? So whether you're a son or a daughter, a mother or a father, a spouse, you have served in the role of caregiving along the way. But sometimes that gets a little bit more intense when that person becomes 100% dependent on you, and you didn't see it coming. That kind of changes your role and changes the hat you wear. And sometimes it's hard for a daughter to become the one that's in charge over the mother, right? And so and sometimes it's hard when your life partner is no longer your partner, but but dependent on you. So changing those roles. So what are the things I have learned? I will say one more time, well, not one more time, I didn't mention it, one more thing. I was a caregiver for a dear friend at my church. She was 79, turning 80, diagnosed with stage 4 cancer that had metastasized to many different places. She asked me to be her what's the word I'm looking for? Power of attorney. Yeah, there we go. For medical decisions and for financial decisions. And because she did not have children, she was a widow twice, and she had one brother, and he was a full-time caregiver in Arizona and could not help her. And she too wanted to stay at home. So I was able to come alongside her in that process, and we were able to keep her in her home. She passed away in her home while she was on hospice in that last 6 weeks of her life. We did that by I engaged with the neighbors, so because I was still working, actually two jobs, and so I would go and spend the nights with her, and then I arranged for different members from our congregation to come and stay with her every day. Plus, she had the nurse, because she was by that time on hospice, that would visit, and she would have a CNA that would come every day as well. And then whenever I couldn't get it covered by the church or the neighbor, then I had a little window of time that we actually paid caregivers to come in from personal care assistants to come in from an agency. So using all of those avenues, we were able to keep her in her home, and that was so that was my big my big caregiving experience, but it was quick. It only lasted 8 months. So that's a short amount of time compared to the caregiver journeys many of my people are on, because when you're dealing with progressive neurological disease, it can be a 3 to 20-year trajectory, right? So very, very different. What are the things that I've taken away? These are the big ones. Build a care team for you and for the person you're caring for. And it does not need to be the same people on both teams. You know, you can have, when I say build a care team, I mean people that are willing to tag team with you. The next thing I've learned from, so maybe the person you're caring for has different friends than you do, right? But you can still reach out to those friends and ask them to come in and be a part of that person's life. Next thing I'm going to say is continue to do the things you enjoy doing for as long as you are able to do them. So make plans to go to lunch with a friend. Make plans to take a walk and get ice cream at the end. You want to make a trip, do the things that you enjoy doing, you want to do. Do not just curl up and let yourself wither away within your home. So that would be the next thing I would say. Continue to do. Change your environment so that it's easier. So if you need to get rid of clutter, do it early. If you need to take out the cute throw rugs because they're trip hazards, take out the cute throw rugs because they're trip hazards. You can actually get a lot of really great information from occupational therapists that can help you make smart changes to your home. Put in the safety rails in your bathrooms, right? If you want to stay in your home till the very end, then put into place the things that you need for safety and to be smart. And then let me think. Build a care team for you, and then make changes to your. That's it. That's as much as I've got for you, friends. There you go.
Verla, you just gave us a platter of great resources through Ruvo, you know, maybe to patch you into training programs or different workshops and seminars that can stand in support. And now and all the way down to what we can do to sustain in our own homes or help somebody sustain in their own home. And so now I'm seeing some really wonderful
I have
questions.
one more thing. Can I say one more thing?
Go ahead. Go ahead.
Okay, so here's the one thing I let it slip out of my mind. I didn't mean it to. So friends, you know how when you first have a situation, people will say, oh, if there's anything I can do for you, let me know, right? And you're like going, oh, no, I've got it covered. I'm good. I'm good. And then pretty soon people quit asking, but all of a sudden things have mounted up and you're buried under the heap, correct? So here's the thing. Keep a list of things people can do for you so that when they ask, you can assign them a task. Now, if you've passed up the point where they've quit asking, make a list of things people can do for you and you ask them. Because if they asked you in the past, they're going to be still willing to help you now. So that would be also a really smart, and I didn't learn that from me, I learned that from my caregivers. So anyway, okay, now I'll be quiet.
No. That's what this is all about. And thank you, Verla. Great tips. More are going to pop into your head, I'm sure, as will Jane's and Heidi's. But I do see a question that came across in the chat room, and it's actually one that resonates with me. And it basically says a friend is having a hard time convincing her mom to allow a caregiver to come into her home. So friends will offer, caregivers will be engaged to come in so you as a primary caregiver can get away and get a break. But mom doesn't want a stranger in her home. The question says, my friend really needs a break. Any ideas from helping her get her mom to be receptive to a caregiver? Jane, do you have any thoughts?
I do. First of all, I think it's essential that you have conversations with the person that's going to receive the care. So you really truly understand what their priorities are, what they're comfortable with, and what they're not comfortable with. And as far as how do you bring a caregiver in? And I think it's, if you can pair it with good experiences, your loved one will become comfortable with other people being in their home. In my case, we had tea together for several months in a row with different people that were going to become part of the caregiving team. We also had people that my mother-in-law knew really well because they were always part of our holiday celebrations. And one of the aspects is, like, one of my friends takes my mother-in-law to breakfast once a month, which gives me the opportunity to go and do anything I want. And my mother-in-law's happy, my friend's happy, because like Vera had said, that list, well, in our family, we send that list out for birthdays and holidays as, what does grandma want? And it's not usually gifts of things, it's usually time with her. So she has so many people that send her mail, that call her on a monthly basis, that just stop by or come and take her to dinner or lunch, or even just sit and have tea with her. And all of those aspects were developed in those conversations about what was really important to her. She's a very social woman, and we had to make sure that that was a really main part. She can't get out very well anymore, so when she does get out, we take special care in making sure that she's safe as she gets out. But all of the people that are part of her team understand what her needs are, and so going out happens on a regular basis for her.
You know, I see Heidi nodding too. Heidi, you want to throw anything into that discussion?
Absolutely. You have to figure out what's going on with your loved one and what motivates them. And yeah, I would say when it comes to, you know, you got to be honest with your loved one. It depends on their cognitive abilities to understand what's going on with them. But it's very important to let them know that you're trying to keep them at home, and that share your burnout with them. You know, don't try and hide the fact that it's a reality. And just say, hey, I just need to take a little break. I know you'd love to go to lunch with so-and-so. What do you think about that? And if you tell my mother-in-law that, she will jump at that. She loves going out to lunch. So you find friends, you find people that she can connect with, or whoever your loved one is, and encourage that to occur. Yeah, it is so challenging, but I think honesty is huge. And it can be very easy for us to assume, as our loved ones are going through changes, that they don't get everything. And we can't, it's not an all or nothing game. They understand some things, maybe not others. You know, I would say, I saw somebody asking in the group of, you know, how do you find some me time? Well, if you have an aging loved one, if they're anything like mine, boy, did they have routines. Because routines are very comforting to folks, especially when some of the cognitive issues are going. So if you know that your loved one is going to take a nap every day from one time to another, schedule some me time for yourself to do something you like to do, whether it's just binging some silly TV show or taking a little walk, or even if it's around the house, so you're close enough to where if you have to respond, you can. But, you know, breathing some fresh air and taking some time, even call a friend and catch up with them.
So I see another question that came through too, and it's how can families pair with providers to maintain a person at home, but have a tag team approach to care so family can have respite, vacations, and work life. And that's a very interesting question, because that kind of bridges to the point where you have paid caregivers that come into the home. And I'll tell you personally, my mother had a massive stroke when I was 21. So I took care of her at home for 9 years in conjunction with running our care facilities, and also going to the university and completing my degree. But she would fire them. I'd come home and they'd be gone. So she took care of that and made certain. She said, I don't need babysitters. And then for us to go away, when I later got married, and I had her for 9 years. When I later got married and we wanted to go away, we did horse shows. She would call me up and say, you have to come home. There's a problem at home. So there's always that connection of comfort with a family member that our loved ones have. But how do we stage to now have maybe a provider team? And I'll just, Jane, you're nodding. You may want to take that, or Verla or Heidi. Just let me know which one of you want to jump on that one first.
I'll go ahead. In my experience, we have used for vacations for sure. Well, in our family, we have different people. So when my husband and I go on vacation, my brother-in-law and his wife step in, and they don't live right here, but they live close enough. So either they come and stay at our house, or just so that there's someone local that can take care of issues and work with the caregivers the paid caregivers that we have supporting her. But we also use our family and friends, and we have a log that people sign in and out just so people know if there's anything new that has happened. So when people come in to her home, and it's her home and it's set up the way she wants it, but we do have one special location where the emergency papers are, where the log is, and it's always at the same place. So people know where to look, and they can leave fun little messages too. Not just, we try to make it kind of full service, the important things, but also just the fun things. And we piece it together that way so that everybody feels they're valued in this team, and that we are relatively sure that when we leave, that it's going to be pretty seamless, if at all possible. Now, emergencies come up, and, as much, I'm a planner. So that is, I try to make sure that I've covered all those emergencies, but there's no way in the world to cover every possible emergency. And so we have levels of emergency contacts. If it's, she needs to go to the hospital, then these are the contact numbers, but they're all listed in the same place. And it goes, that contact list, we have 2 copies, one that stays in her house always, and one that goes with her wherever she goes. So her medications and all of those things are on there. So if she were taken by REMSA, that would go with her, because it has all the up-to-date information. And I guess, how you as a caregiver, you decide on what your priorities are. Ours are that is always as up to date as we can possibly make it. So as soon as we're done with a medical appointment, that gets entered into that data sheet, and it goes with her wherever she is. But we try to keep that at a low key, that it's more about her day-to-day life and her staying happy and being engaged in living every day that she has.
Jane, you sounds like you've woven a tapestry or a quilt that's pretty much covering everything. But maybe we can take a look at it as that kind of a model. It's not crisis management. It is the planning and putting the pieces together so that they align in different circumstances or different conditions. And I've seen in our chat several comments about involving the individual that we're providing care for, which is exactly right. You don't do to people, you do with people. We've heard the word care partner, and that's so important. Is there anybody out there in our participation pool We've got a nice bunch of you. I've been kind of looking at what's coming through the chats, but anybody want to say something? Take yourself off mute, raise your hand, and you can contribute as well.
I just
Any
wanted
thoughts?
to add that part of the reason I love care partner as a term is because it always reminds me that the experience is a joint venture. It's not just about me, it's about the person I'm caring for as well. And keeping that and being mindful about it so that when I'm with my loved one, I'm really there, I'm present. I'm not thinking about a zillion other things that I have on my mind, which, I'm not perfect. I'm sure I do that sometimes, but I try very diligently to practice my mindfulness so that when I'm with my mother-in-law, that I'm really there and attending to her. So she always knows that when we're together, she is my priority. Now, of course, it doesn't always happen that way. And so I don't want to give anybody the impression that, oh, it's always wonderful and lovely. But with that being our central point, that we are really committed to making sure that she has the life that she wants, we try really hard to make sure that the focus is on her.
So anybody out there? Do we have thoughts? Do we have shared experiences? We've had a really wonderful discussion so far. We've got 15 minutes left. I want to be sure. Barry, yes, Barry, I see your hand.
Yeah, I've heard people talk about it, and they've talked about caring for yourself, but I just want to repeat that because we keep talking about how we can take care of the person we're taking care of and doing the best job for them. But we've said this before, but if you do not take care of yourself, you cannot do a very good job of taking care of somebody else. And that's usually the first thing that people forget about, is themselves and to take care of that. So I just wanted to bring that back into the dialogue.
Anybody have thoughts on what Barry just said? Heidi, yes.
So my way of self-care, because I'm a control freak, it is to plan ahead and think of the things that if they were off your plate, you could relax a little bit. So my husband and I kept trying to figure out little workarounds, things to where it took some of the worry off of our plate. So for example, we discovered that my mother-in-law, who always paid the bills, she was the one that was handling the money pretty much the whole time. My father-in-law didn't have a clue what was going on with finances, but we would discover that mail wasn't being handled. It wasn't being taken care of. And then it would be a pile of mail would be wrapped up with a rubber band around it. It was stuffed in a basket or on a shelf or in a drawer, and things weren't being handled. And then we weren't even sure what was coming out of the mailbox or not. So we actually purchased a locking mailbox, and we have a ring camera on the mailbox as well. So we know when the mail was arriving. And then we did not provide a key to my in-laws, but we would immediately go out and get the mail and then share the mail with them. So they knew what was going on and that we would help them take care of it. So that was one. Another one, and this one was hugely valuable. My mother-in-law, I think she'd been struggling with some cognitive issues for a long time and had all these interesting little workarounds. Well, she had calendars everywhere. So there were wall calendars, and there was one by the computer, and then there's a little day planner in her purse, and none of the calendars matched. There were things that were getting missed. There were doctor's appointments being missed. And my husband said, you know what, there's got to be a workaround to this. And he found a calendar that is a monitor system that links in with your electronic calendars on your smartphones, called DAC board. The subscription is like $5 a month. And we created separate calendars on the iPhone so we could connect those to this digital calendar that went on the wall. And it looks like a traditional calendar. It isn't something completely foreign to my in-laws. and they would stop and stare at that thing to see what was going on. They'd read, there'd be like a little news blurb that would show up on the calendar as well, and they'd read about that or whatever. But when we knew there was a doctor's appointment or we had to take them somewhere, they knew where they were going and we knew where they were going, and we could share that with whomever we thought needed to know that information.
Heidi, how do you spell that? That
It's,
DAC board?
it's DAK board. It's all one word.com.
And if you look in the chat, I've just posted the link to it.
Awesome.
Yeah, it was hugely valuable, and we did go to using cameras as well. It allowed us to not be in the house all the time and give them their autonomy. But we could go back, especially we use the cameras more if something kind of went wrong, we could go back and look at the recording after the fact and see, okay, what happened here? And we were very careful to not put them in areas where they should have privacy. I'm not going to put a camera in a bathroom unless I think it's absolutely necessary, but that wasn't the case. We had them on the front door, we had them on the back door, we had them in the kitchen. Because that was another thing we did, is to where we actually turned off the breaker to the stove because we didn't want little hockey pucks of grilled sandwiches and glue that used to be soup on the stove. But we came up with workarounds. We moved the microwave down to a location that was easier to reach, and we got frozen meals that they could microwave, and they could cook their soups in the microwave and still feel like they were providing for themselves.
So basically, sounds like you preserve dignity, but you also preserve sanity for you.
It's a fine balance, yes.
Yeah, well, it's the unknowns that I think tend to put us all in a circumstance of discomfort. It's what you're wondering about what happened and or what might happen when you're not immediately available. So that wears you down as well. I see Amy actually has a question for us to loop back to how do I convince my loved one to accept a caregiver? She said she suggests that respite care plans not only focus on what the care partner needs, but also uses a truly person-centered process to ensure time spent. Amy, why don't you open up your mic and tell us about this?
Sure. Sorry, I'm even long-winded in the chat.
No, but it's okay. A voice is better than me reading what you said.
Yeah, and I'm actually on my mobile phone because my Wi-Fi is a little choppy today, so I apologize for no camera. But yeah, so I just, I've noted I'm with the Neighbor Network of Northern Nevada, and I've noticed that when we have that kind of like buy-in challenge where the care partner is on board and really needs the break, but they struggle to get their loved one to accept a quote unquote stranger or somebody coming in and providing that break. They're fine, they don't want it, they don't want to have anything to do with it. And so we've certainly encountered that at N4, and sometimes it does take some time to build that relationship and trust and matching them up with the right care provider, respite care worker. But in time, I think when they see that we've really made a gallant effort to, spend that time doing things that are really, really meaningful for the person receiving care, it makes it fun and it makes it more valuable for them. And so we tend to get that buy-in. And that includes, taking them out into the community, doing different activities and things that they enjoy. And I think it also can sometimes give that care partner a little bit of relief so they feel okay taking the break too. So kind of relieves that anxiety when they know that their loved one is really enjoying that time. And it doesn't have to be just, supervision and, I appreciate like the safety piece and everything, but I think that we really have to get outside the box and just think about what would we do, if we had, time and had somebody to kind of take us out and do something fun, what would our answer be to that question? And so I think we need to look at people receiving care and that through that same lens.
Yeah,
That's why that conversation is so important.
Go ahead, Jane.
I said that's why that conversation with the person that's going to receive care is so important. So you can build that person-centered plan around what they want.
For sure. Yep.
You know, we have so many wonderful resources now that we didn't in the years that I shared with you that I was caring for my mother. My only resource at that time was newly married. I decided I better have a baby, and that way I could hire babysitters instead of caregivers for my mother. And it actually worked really well. But those of us that are kind of older, it doesn't work like that, because the individual that you're providing care for doesn't want that person just sitting. So Amy, some of your points that you brought up, I love Jane's, you know, the tea, having him in for tea or cards, or maybe not everybody wants to play games, but or just companionship and cookies, watching a favorite soap opera. Who knows what it might be? But they do still have soap operas, don't they? I haven't watched for a while. But anyway, anybody else have any thoughts? Yes, Heidi.
So another thing to give yourself a little bit of downtime, and it depends on the friend circle of the people that you're caring for. My mother-in-law, who's 87, still does they used to do a girls' luncheon where she would travel to go meet with her friends from elementary and high school. Well, now they do it via Zoom.
Wow.
And so what I do is I take my laptop computer with a camera in it over to her assisted living facility where she lives now. And I get everything linked up with all of her friends, and all of her friends have various caregivers that help them with the technology to get the Zoom call going. And then these ladies start chatting away and sharing what's going on in their lives and what they think of their assisted living communities and whether they're still at home. Or I've even had someone saying, I don't know why I'm still in a home. I've managed to avoid it, but I probably shouldn't. They're pretty honest with each other. And when they're doing that, I can sit back on the sofa and open up my Kindle and read a book for an hour. And just know that she's having a wonderful time and I don't need to worry about it.
Yes, technology. We never had that before too. And maybe we just think we need somebody in the house or in the location, but not so much the creativity of additional resources. Larry, you asked a question, and I'm not quite sure I understand what that is. Why don't you go live and tell us what you're thinking?
Just get off mute here. Just wondering how many in who work have that responsibility, also have care partners that they have to take care of, and what kind of help do they get from their working environment, from their supervisors or the work situation itself.
So I was just typing an answer to you, Larry, and so I'll just say it verbally. My brother, his wife has been diagnosed with early onset Alzheimer's. She's in her, she's 61. And so he is pre-retirement age as well. And he has been allowed now to continue to work from home, even though they have called people back to the office now. He continues to work from home because he was able to submit the paperwork that his wife has been officially diagnosed with early onset Alzheimer's and cannot be left alone. So he works from his dining room table remotely. Whenever he has to go in, then he finds a caregiver to come and be with his wife. Actually, my mom, who's 93 and a half, oftentimes will go over and sit with her so that he can go to work and she can still be cared for because she cannot be left alone. So that some work, I mean, I think if my brother-in-law did not have that situation, he'd be back in the office. So they were very accommodating to him. I think we learned a lot in the pandemic. Now, if you have a hands-on job, that might be a little bit different. So Yeah.
Excuse me. Excuse me again. Well, we've had an amazing conversation. I mean, we're at the 3 o'clock time. Marcia, do we have any bleed over room, or should we just go ahead and call for a wrap up and save additional thoughts and conversations for a future? What is your guidance?
Yeah, let's just get final thoughts from our panelists. One last word of wisdom that you want to share, and then be time to wrap up.
Yep, I think, Jane, let's go ahead and start with you since we began before.
First, I will put several links. I will send several links to Marcia that may support some of the questions that were asked, that people may want to use in the future. Some really major ones, though, that if you don't have these numbers, you might actually want to write them down. One is, oh no, sorry, I got the wrong page. Well, I'll put them in the chat and Marcia can send it out. One is the 24/7 Alzheimer's helpline number, which is 800-272-3900. They have professionals on staff 24 hours a day to answer people's questions and to support them if they have an emergency going on. In the new National Suicide Prevention Talk Line, which just started like July 7th. It will start on July 17th, and that is 800-273-8255. Just two important numbers that if you need immediate support, you have someone available to you, along with others that are more local numbers. And then I guess my final words are collaboration, collaboration, collaboration. There's so many willing participants out there. If they know that you need help, or if you know what you need, to put the word out, what help you need. And I think you'll find that there's an awful lot of people in our communities that are willing to step up and help you. So collaborate.
Awesome. Heidi? Final words?
My final words would be, know that we are out here to help. So we've provided our emails and our phone numbers at the beginning of this presentation, or mainly conversation. And sometimes people aren't comfortable talking on camera. And just know that I'm there and I'm an ear to listen. There are wonderful people out there that listened to me when I was having my little meltdowns, and we all have them. And I am convinced that the one thing that I've recognized is the closer something gets to my fears, the more it bugs me. So as I watch my in-laws aging and the challenges that they have, when it hits on things that resonate with me personally, where if I was in the same situation, I don't know how well I would deal with it, to recognize that in myself, have some self-awareness, but just know that we're here for you. Not going to have all the answers, but between all of us collaborating, that we can help.
Awesome, Heidi. Verla, thoughts?
So I'm just going to say one thing I think we didn't address is when choosing a personal care assistant or an adult daycare, shop around. Look and don't just go with one and done. Call them, ask them your questions. There's some great resources for good questions to ask. What will you do with my person when I'm gone? What activities will you have planned? I don't want my person sleeping while I'm gone, so and then shop around. You're going to get a sense when you talk to the different agencies which one is going to work with you. And I loved also, Jane, what you said. So if you have tea with somebody long enough, all of a sudden that person is no longer a stranger, right? So make the person you're bringing in not a stranger by weaning them in incrementally. I could probably go yammer on because I've always got lots of words, but I'll stop there unless anybody has anything more specific that they want. Mhm.
No, and we have gone over our time, but I feel every moment is worth it. I think the engagement that we had, the collaboration, but that's the whole purpose of what this is. This is the Caregiver Coalition. It's meant to coalesce, to bring people together, to have these conversations, to have access to resources and connections with each other. And I'm seeing some lovely feedback from individuals. So I do want to thank our amazing panelists for their knowledge and wisdom. We'll be back on October 13th from 2 to 3. So please keep that in mind for more comprehensive look at services and residential care for children and youth. I think there would be additional tips out of there regardless of the age span that you are caring for. And I really want to extend heartfelt gratitude to Marcia O'Malley for her being able to hold us all together, keep us on track, get our recording done, make sure we're all live, make sure we save our chat. Don't forget to save the chat. Like Mary said, if you want to save all of the little comments, go to those 3 little dots and click on Save Chat. And Mary, Cheryl, Tori Diego, Marta Malone, Kathy Doyle, and Deanna Hearn, thank you for being such mainstays of the Caregiver Coalition. And most importantly, thanks to all of you who joined us today, the 30 of you who stayed right to the very end. What an important conversation we had. And please remember, these recordings of today, in case you forgot something, you're going to be able to go to the website. Marcia will notify you when recordings are available, and share them with your friends. There was some good guidance that came down today and some great wisdom that was shared across the board. So thank you one and all. Hopefully we'll see you next time. Thanks for joining us.